I have in me that is classified as giant. She leans into me and she goes, "You're filled with blood."
Hi friends, welcome back to my channel. My name is Aina and I'm an oncology pharmacist. I noticed recently that more and more creators are more open about sharing their hardships in life. Recently, I saw Geega sharing her story about living through cancer and how that actually turned her life around. I really wanted to make a video to understand more about her condition and understand what she went through.
This is a story about my health and stuff I was going through that I've previously talked about a little bit on stream, but I've always been incredibly vague about. I think I mentioned, hey, I almost died to people, and they thought maybe it was a surgery only related thing, but realistically it was a lot more than that.
So what Geega actually went through was a form of ovarian cancer, and we'll get to that in a minute. In America, a woman's risk of getting ovarian cancer in her lifetime is about 1%. But it's one of the most difficult cancers to catch early, and there are two reasons why. One reason Geega will describe in a minute is that the symptoms are super vague and unclear, making these groups of symptoms hard to pinpoint on a cancer diagnosis. The second reason is we have not developed a good test yet to catch this early. There are also cancer markers that you can test in your blood, for example, CA-125, but actually all of these tests have been studied in clinical trials and they all failed to detect early ovarian cancer. So unfortunately, a lot of the cases that I see in our cancer hospital are late-stage ovarian cancer.
4 or 5 years before I had my surgery, I had symptoms then that I did not know were symptoms of what was going on with me. And what it was, I was having an issue with my skin, which I never had. When I was younger, when I was a teenager and all through adult years, never had an issue with skin.
Okay, when she said that the problem was only around the corner of her mouth, I thought it could be perioral dermatitis, which is exactly what she's describing. Also, the majority of the cases for perioral dermatitis are in women between the age of 16 to 45, which Geega fits right into that age demographic. Of course, another diagnosis for women with skin problems, especially around the chin area, would be acne.
We'd tried different things. They tried putting me on different things to adjust hormones and stuff like that because nothing topical would fix it. It was not an issue with my skin on the outside. This was caused by hormones.
Okay, so she's saying the doctor talked about hormonal shifts. They probably thought it was acne, but there are certain underlying conditions that can cause acne. For example, polycystic ovarian syndrome, which we'll get to in a minute because that's what Geega's doctors first thought she had, and ovarian tumor.
So I said, okay, let's try these things. And they all made me feel like shit, or they didn't work out that well, or they caused other issues that I didn't like. So I was like, let's not do this. I'll just deal with it because the issue wasn't that bad.
Yep, like what Geega said, the oral treatments are either birth control or you can take oral antibiotics, and there are even stronger things out there to cure your acne, which will make you feel really bad. So if we're giving these drugs to a healthy woman and the skin issue stops, it just means that we've now helped to regulate the hormones in their body. But if it's a real disease, we're just masking the problem. Does this mean this is a misdiagnosis from the doctor? Well, not really, because at this point, the doctors will usually go to the most likely cause for your problems. What's the percentage of women who are healthy but get acne? A lot. What's the percentage of women that get acne because they have a tumor? Very little.
Fast forward to about a year and a half before I ended up having my surgery. So a couple years later, I've always been relatively thin. When I wake up in the morning, if I'm laying down on my bed and I look down, if I haven't eaten anything and I don't have to pee real bad, stomach flat. And I noticed at some point that I just kept being bloated. Not constantly, but we're gonna talk about women's health. Sorry, fellas. But when I would have my period, I would bloat. I would go in and out, And at some point I was like, it's not going down that much. And I'm bloating more and more each time, and it's getting more painful each time. Since that skin issue up until then, it had incredibly gradually been getting worse.
Okay, so this is definitely the first sign that something more serious could be going on here, but not a definite cancer sign yet. During the period, there's a lot more estrogen and progesterone, and that causes the body to retain more water. But the point is, it should go back to your baseline after the period is over. What sounds a bit weird to me right now is the way she said this just came out of nowhere, and the fact that it doesn't go back down.
Yeah, so we thought it was something like PCOS, which are like ovarian cysts and things where you get little cysts. They're very normal. A lot of women get them on their ovaries and things, and they cause hormonal issues, which then cause the skin thing and cause the pain.
I'm definitely getting the vibe that Geega is a very intelligent person, just based on the way that she explains all the physiology and talks about these conditions so effortlessly, and she's able to explain it quite well, actually. Medical people love abbreviations. Polycystic ovarian syndrome, PCOS, but we just call it PCOS. It's probably because all the medical terms are so long and difficult to pronounce that when we talk to our colleagues and other doctors, it's just so much easier to say PCOS rather than polycystic ovarian syndrome every single time. Yeah, so this goes back to when we first talked about how PCOS can be a cause for acne. For example, polycystic ovarian syndrome, and it makes sense that her doctor suspected this. It's a pretty common condition. Around 10% of all women live with PCOS, but if we look at the ovaries of a woman with PCOS, you'll see small cysts in the ovaries. They can actually produce hormones, and that causes the imbalance and leads to the acne.
What she was doing was she was pressing, and when she would press on it, if one side she would press on would go down, the other side would go up. And it would go like this. Ooh. So when she would press one side, it would go, meaning there was a lot of pressure, or it was at tension, or it was perhaps more than it was not soft tissue. You know, as soon as we both see that, we're like, oh, she goes, "You're not pregnant, right?" And I said, absolutely not. Because every single time I went to any doctor, they all asked me that question, and they all made me take a test anyway, even though I said I'm not. And not just the normal test, they made me do blood tests every time. And I said, I've had like 20 blood tests in the past year. I'm pretty sure it's not that. And I've been having this issue for years. And she was like, all right, we're still gonna do the blood test. I was like, ah.
Alright, but we're definitely guilty of that, the making sure no one's pregnant part. But it's very cool to hear it from a patient's perspective though, and yeah, I can definitely understand the frustration. There are a lot of tests or treatments that we would normally do, but we can't do in a pregnant woman. Our policy is to do pregnancy tests in any woman that falls between this age range. Can you guess what that age range is? You can pause this video and comment down below to tell me your guesses. The answer is between age 11 to 56. Isn't that such a wide range of age where we consider the woman to still have childbearing potential? As you can understand, if the patient has cancer, we're going to be giving poisonous chemotherapy drugs to the patient's body. And if there's a baby growing in there, the baby is going to be exposed to all these harmful drugs and they can't develop properly. For example, there are these drugs that we use to treat cancer called lenalidomides. We make the woman do a pregnancy test every single month, and we literally cannot give out the medication without seeing the negative pregnancy test. And Geega's right, we don't trust p-tests because it can give out false negatives. We only trust the blood tests.
And she said, I don't want to biopsy this because we don't have eyes on it. We don't have visuals on it. So let's do an ultrasound. So I'm laying down, they put the jelly on me. It's all cold, it feels freaky. The technician, and this is months later, by the way, because things take forever to get, apparently.
Oh, I'm surprised to hear that. I thought in America, since it's private healthcare, things should move along faster. And even here in Canada, ultrasound shouldn't take that long. I think usually it takes about a month for you to book in an ultrasound appointment, especially for more urgent cases like Geega's, where she's quite symptomatic, right? She's talking about her stomach bloating out, and that never happened to her before.
She has that thing, horizontal cross section, you know, looking at it from this side this way, with me laying down. And it's mostly black. Black is like liquid or air. It's a big circle. And it's mostly black with an edge with a border. It's a clear encased circle. She says one of the funniest things I've ever heard. She goes, I'm gonna shake you. It's like, what? I'm gonna shake you. So she's got me on the table like this. She goes, I'm gonna shake you, and I want you to look at what you see in the liquid. And I was like, okay. She goes, and she shakes her hand a little. She goes, like a little, and I look, and I see particulates floating around. I see little bits, little dots going, getting unsettled, like silt in a riverbed, right? Getting kicked up. She goes,
oh wow,
that's blood. She leans into me and she goes, you're filled with blood.
I feel like the toughest part to go through though is knowing that there's this bad thing growing inside of you, but no clear diagnosis of what it is. So she's describing a clear border surrounding the blood and the fluid that's inside her. At this point, all we know is that this must be a pretty big ovarian cyst. What could be worse is if there's a different type of liquid filling in your gut region called ascites. That would be bad news. Cysts are fluid-filled sacs with border lining it, right? Ascites would be fluid directly in the space of your belly. If we see ascites and masses in that region, it could be a sign of late-stage cancer, and ovarian cancer is one of the most common causes for this. That's because in late stages, the cancer cell starts to travel around. And if the ovarian cells start traveling inside the body, they can now adhere to any of the organs in the belly and start growing there. These cancer cells start growing and they start to produce fluids. They can also damage the lymphatic system, which is supposed to drain these fluid away. So what happens if you have a lot of fluids and you can't drain them? You get fluid buildup in the belly. So at this point, I'm really happy to hear that this sounds more like a cyst rather than ascites, even though both are fluid buildups and they can cause similar symptoms.
So I have a cyst in me that is classified as giant. I don't remember the dimensions at that time, but I know height-wise it was more than 20 centimeters. Keep in mind I'm 4'10", and I had only recently noticed it.
Wow.
So we figured that information out from the ultrasound. I go back to my doctor, we're going over the images. And we're all really concerned about not the cyst itself, because I'll be honest, huge ones are scary, but cysts are really normal for women. And they get rid of them all the time. A lot of women have them. Almost all women get them at some point. Big, not really, but like little ones, it's normal. That wasn't what we were concerned about, especially because it was just one cyst. It didn't have septations, which is when it's like segmented and they're like multiple parts blobbed together. It didn't have that, that was all fine. But there was some sort of solid mass in it. That is not good because now it's a complex cyst. It's not a simple cyst. That's bad, right?
Does Geega have a health science background or major? Because just the way she talks about these diseases and images and tests, she sounds so professional.
That takes months to get this MRI, of course, because, while we are at this point suspecting really bad things that this could be, we don't have direct evidence and we can't biopsy it because you cannot puncture this thing. Depending on what's in it, you can expose the body cavity to all that. Yeah, you can't pop it. That's crazy.
So why are we not popping this and draining it to make her feel better? Or even can we somehow just draw a little bit of the fluid and test in the labs to see what this is exactly? Well, the short story is it's not recommended. And the long story is because testing the fluid of a cyst rarely gives us a correct diagnosis. So a biopsy is taking a part of the tissue and you're examining the whole tissue with different layers and different types of cells. And that will be the most accurate way to find cancer. If you're just drawing up this liquid and testing that, you might only find one type of cell on there. You might not find anything at all. So that's not a reliable way at all to detect cancer. Well, what if we just rupture it, suck the liquid out, and the cyst will go away? Yeah, we could do that and that will make this cyst go away. But there's actually a very high recurrence rate. It can also make the prognosis worse if you get the liquid everywhere in the belly, because if this was cancerous, it can just grow anywhere in the belly that it can attach itself to, and it will be very, very hard to get rid of later on. If a biopsy is not actually physically possible because for whatever reason, we just can't get to the ovaries, we'll do something called upfront primary debulking, which is just a surgery to try to remove as much of the tumor as possible. At this point, we don't even know what it is because we can't do a biopsy, but we're just gonna remove it first. And then once outside of the body, now we can properly test out what type of cancer and what stage it's at. And then we'll decide on what treatment plans to make for the patient.
We need to get an MRI, but because we don't have any direct evidence of it being anything like crazy, near fatal, whatever, they're like, that means you're like low on the wait list. Also, because I'm not super old, I'm not currently dying as far as they know, et cetera, right? So I have to wait forever, and just live with this thing and hope every day that it doesn't pop, not being able to move properly, having all these other health complications, like tons of other health complications with almost every organ. My heart was even being pressed on when I breathed, right? For example, there was just no room, everything. But I was fine because I wasn't super old and I didn't have any biopsies saying that it was something bad, so, right?
I don't know if you guys got this YouTube video on your recommendations, but it was basically a neurosurgeon talking in front of a camera for about 2 hours, telling us why he decided to quit his job. Well, I got that video recommended, and a lot of my friends that also work in healthcare also saw that video. And in that video, he talked about preventative medicine versus treatment. And the fact that it seems like in current hospitals, our focus is on treatment rather than prevention. And based on Geega's experience, this kind of fits him perfectly. The healthcare system is just so busy treating patients who are actually dying or who actually have a cancer diagnosis. And I guess what she will have to do is wait until she actually gets to that point where she's actively dying, and then she will be moved up on the wait list. But that's too late most of the time. So we're definitely far from having a perfect healthcare system.
Because I talked about my health. I didn't give specifics, but I said, hey, I have some issues going on, whatever. And I didn't want to scare anyone, so I wasn't going to be like, yes, might be dying, whatever. The whole time, the prognosis was not looking good and the staging was not going well, the expected staging. So the idea was you're going to get out of this surgery. It's progressed a lot. So even though if we get this out, it's not gonna go well very likely. Your likelihood of making it is still not great. Not through the surgery, but like after that, you know? So this was the assumption this whole time.
So there are basically 5 different types of ovarian cancer: HGSE, LGSE, clear cell, endometrioid, and mucinous. This is already simplified. And within each of these 5 types, there are different genetic factors, there are different stages, and all of these combined together will affect the treatment plan that we make for you. And the most common type is HGSE, which is called high-grade serous carcinoma. So the prognosis for ovarian cancer is not the best among all cancers. Obviously, it depends a lot on the stage, and cancer prognosis is calculated by this, a 5-year survival rate. This is a percentage of people that are still surviving after 5 years of their diagnosis. Generally speaking, in ovarian cancer, stage 1 has a 5-year survival of about 80 to 90%. Stage 2 is 50 to 70%, stage 3 might be 30 to 40%, and stage 4 is about 15%. Which means if 100 people got stage 4 ovarian cancer, then statistically speaking, only 15 of those people are still alive after 5 years.
So there he is, chopped up in a lab. They do little smears. They cube that shit. They cube the whole thing, and they do smears on slides of every little bit of it and test it. And they were like, wow, a good number of these cells are what we call pre-cancer, which means they're expressing a lot of the proteins that would make them cancer cells, but they're not. They're like 90% there. Not all of them have made it to the point where they can spread, which is good. There are also malignant cells in there, absolutely. But a lot of the outer cells, like around the outside of it, were pre-cancer. So the stuff physically on the outer bit of it was kind of just sitting there and keeping the stuff from the inside from spreading.
Wow.
Now, that being said, if that thing had been left in me for longer, those would have eventually just turned into the same thing.
Yep, that sounds so amazing. So that means no metastases, which means there's no spreading. There is malignant cells in there, but it sounds like it's either borderline ovarian tumor or just very, very early stage of ovarian cancer. I wonder what kind of post-surgery treatment she still have to do, whether that's chemotherapy or radiation therapy. But I guess that would all depend on the biopsy results and exactly what type and what stage of ovarian cancer she had.
And I'll be honest, losing an ovary is nothing. You have 2, and the other one just does the job of 2 when you lose one. So I was like, hey, of all organs to lose, that's great. It's even easier than losing a kidney, to be honest. I was like, will my life be affected? They were like, nah, you're not even gonna notice. I was like, oh, cool. I mean, and to be honest, I was like, can you just take all of it out? And they were like, no, that's how you get osteoporosis. I was like, okay, fine. Fair enough, you're not wrong.
If both ovaries were removed, the woman would go into menopause immediately. That means no more period, and it might sound like a great thing. And if you're someone that maybe don't want children, that might even be better. No more period, no more unplanned pregnancy, life is wonderful. But the truth is, the reason why your body goes through menopause is now you have a very, very low amount of estrogen. You lose that protective effects of estrogen that has on your heart and your bones. Estrogen can actually regulate cholesterol, and it helps us to maintain healthy heart and blood vessels. And that's why men are more likely to have heart diseases than women.
Continue doing blood tests. I have to do blood tests every couple of months for the next however many years, you know? We haven't seen anything, which is great, but you never know. And this type of cancer has a pretty good chance of showing up. But because we're doing certain tests, it would get caught early if it did show up.
Right, so one of the most common way to follow up on ovarian cancer is to test for tumor markers. But this is a very general marker. It's not specific to ovarian cancer, so we can't really just rely on this. There are other things that she was probably told to do as well, like monitor really closely for any symptoms. She probably needs to do regular pelvic exams as well to fully rule out any chance of a recurrence. Ovarian cancer is just one of those types of cancers that doesn't get a lot of exposure in media. We see a lot of breast cancer survivors or prostate cancer survivors, and we see a lot of support groups and charity organizations for them, which is great, but not so much for ovarian cancer. Sadly, it's because most ovarian cancers are caught too late. If stage 2, 3, or 4, the survival rate isn't really that great. And just because of the nature of things, the story that we hear are usually from cancer survivors. So I'm actually really thankful that Geega talked about her experience, and I really appreciate her willingness to share. I feel like there isn't that much space out there, especially for young cancer survivors, to talk about their experience. And that's something I hope to achieve with my channel, is to create this space, so hopefully we'll get there one day. I'm really glad that Geega's case was caught early and they're doing active surveillance on her, so I wish her all the best. I made a video ranking the survival rates of all types of cancer, so if you're interested, you can check that out right here. If you like this video, please don't forget to give it a thumbs up and subscribe for more content like this. I'll see you in the next one. Bye.